Hi, this is Mary Donlin with Mom TV, and I'm at the Mother of All baby showers discovering all the terrific products as well as services that expecting parents need. And one of the big things that we all want to make sure of is that we all have good dental hygiene and know when to go to the dentist. So I'm pleased to introduce Dr. Craig Lustman. He is with it's PDO.com.
PDOkids.com.
PDOkids.com. Pediatric dentist and orthodontist. So Dr. Craig, as his patient, you like your patients to call you? Give us a little bit of background on when an expecting or new mom should start thinking about dental care for their babies.
Absolutely. Well, it's a pleasure to be here. Thank you so much for having me. The Academy of Pediatric Dentistry actually recommends kids get their first dental visit and establish a dental home by age 1, and that is not only find a problem, but more so to educate parents on the importance of great oral hygiene and techniques of how to accomplish that, some dietary recommendations, and sort of growth and development considerations as your baby gets bigger and bigger. And the philosophy of pediatric dentistry has really changed over the years, and we pride ourselves on being a very preventative specialty and a very preventative practice. And the idea is to go away from sort of treating problems versus managing good health to make sure that no problems arise. So it's been a change in philosophy, and our practice is really welcoming a lot of young babies, and it's wonderful to see a lot less sort of dental decay in these younger kids.
So it's more of a proactive versus reactive scenario for dentistry these days.
Absolutely. We say in our specialty it's reorienting ourselves from the treatment of dental disease to the management of the process. And it's really important because any way you can protect and act versus react is really important in healthcare.
And so much of the research in the last decade has even shown how much that the mouth and dental and good dental hygiene is the gateway to keeping overall good health.
Absolutely. There's a tremendous systemic or body connection with our mouths, and it's the first easiest way for something to travel into our bodies is through our mouths. So, especially in pediatrics, it's, kids are constantly changing and growing, and there's so much, so many considerations, and, all we do is see children, and it's what we love to do, and it's really a pleasure to see these kids get bigger and bigger, and really enjoy coming to the dentist and focusing on great health. And that's what it's about. It's just creating an experience where it becomes a pleasure to come to the office. And I don't think it's always that way in dentistry, but
I would have never said that when I was a kid. I couldn't stand the dentist, but I do think there's been a shift, and you're right, just because we've gotten on top of again being proactive with dental care. And I'm going to ask you one question. I have 2 teenagers in braces and an 8-year-old who they don't mind going to the dentist. So it's probably, like you said, it's just a shift in the whole philosophy. What's the number one food you would tell parents to never feed their child? That is like the one you see all the time that leads to those cavities.
This is an easy one. I mean, there are a couple things, but the first thing that comes to mind is stay away from all fruit juices.
Oh, really?
Yeah, sports drinks, fruit juices, and soda. We recommend water and white milk as the primary and the really only source of hydration for kids. And that's all they need. And if you start them young on water, it's something they get used to, and they really don't sort of crave those sports drinks. Sure. But if you think about it, these sports drinks, there's a lot of marketing done to say, whether it's organic or whether it's 100% fruit juice, and, that's obviously better. But still, there is so much such a large concentration of sugar, and it's so flowable and sticky, and it's really hard to clear from the teeth. So, definitely number one on my list is avoiding those sugary drinks.
Tell us one more time where we can find information about your practice and even tips for good dental care.
Absolutely. So our practice is in Plantation, Central Broward County, and it's been around I think it's the first, most original pediatric dental office, or the oldest office in the area.
Oh, I'm native.
Yeah, exactly. Yeah. So I have 4 other partners, a pediatric dentist and orthodontist, and we're located in Plantation, like I said. Our website is PDOkids.com. Okay. So PDO as in pediatric dentistry and orthodontics, kids.com.
Thank you so much for joining us, and thank you so much for watching Mom TV.